Hello, good afternoon, Professor.
Good afternoon. Good afternoon. We are going to get started in just about 1 minute.
Okay, great. Let me just submit.
Mr. Parameshwaran Iyer.
Hello and namaste to one and all. It's my immense pleasure to welcome all of you here on this first international webinar series conducted by International Center for Clean Water and IIT Madras' initiative. I'm sure you're all looking forward to hear from our esteemed speakers and panel. So without taking much of your time, I would request Professor Pradeep to take over. So.
World has changed in the past 4 months due to something we can't even see. Power of the invisible is indeed incredible. I'm sure that the impact of this invisible on water will be felt, and that needs an international debate. Thank you for joining from this part. Good morning. Originates from a crisis, but it also represents an opportunity. Nature is trying to tell us many things. Although this is a deep crisis, it is also a celebration of science. Everyone realizes that science is the only remedy. Social distancing, hygiene, masks, detection kits, medicines, plasma therapy, vaccines, all of these are manifestations of science. Miracles have disappeared. Science thrives. It's a great time to be a biologist, so also a chemist and a physicist. On this conference, we are expecting to have about 600 plus network of thought leaders and future leaders. We have a fantastic set of speakers and excellent panelists. Most of you who have joined are young. This reassures me that the world will be safe. Please interact and ensure that power of thinking is indeed incredible. At the end of the presentations, there is time for discussion. Your questions posted in the Q&A box will be answered, as many as possible. When you write a question, please mention your name, where you are from, and where you are from. We will bring people live from different parts of the world, if possible, to ask their questions. Our inaugural speaker today is Mr. Parameshwaran Iyer, an upright officer of nearly 40 years of administrative service, who heads the Swachh Bharat mission, a pet initiative of our Prime Minister. He leads the National Rural Drinking Water Program. Mr. Iyer is a visionary. Let me invite Mr. Iyer for his inaugural address.
Thank you, Pradeep, and welcome to all of you from all parts of the world. As Pradeep mentioned, I am Secretary in the Department of Drinking Water and Sanitation in the Government of India. I'm speaking from Delhi. And we have two major programs. One is the Swachh Bharat mission, which was the program which focused primarily on making India open defecation free. And that the country declared itself ODF, open defecation free, on 2nd October 2019. And now we are working very hard to make sure that all the outcomes of ODF are sustained. So the behavior change, communication continues. This was one of the biggest behavior change revolutions ever, where about 550 million people stopped defecating in the open and started using the toilets which were provided for them. but that needs to be sustained, and making behavior change stick is challenging. So that work goes on. And now that program is moving, as we call it, from ODF to ODF plus, which is looking at solid and liquid waste management, which is plastic waste management, organic waste management, grey water management. We did an excellent workshop with Professor Pradeep led for us at IIT Madras, focusing on the different technologies and management practices for grey water management, which is water coming out of the kitchen and bathing, and also looking at black water management. But our major program of focus today is on water, and not just in this webinar, but the big program announced by the Honorable Prime Minister, again in his first Red Fort speech, his first major address to the nation on 15th August 2019, was the announcement of the new drinking water mission in India called the Jal Jeevan Mission, which basically is aspiring for a very, very ambitious goal, is to provide tap water, so pipe water supply in every rural household in India. The current level of coverage of pipe water in rural households is only about 20%. And the plan is to take that to 100% in 5 years. So very ambitious, certainly more complex than sanitation, because as you know, all of you know, in water, there's a question of source sustainability, groundwater management, then the distribution itself, trying to manage it at the lowest appropriate level, and then the water which comes out of the kitchen and bathing, which colloquially called grey water, along with storm water, is about 75–80% of that water. So how do you deal with that? Prevent stagnant water, take it as an opportunity, use it, treat it with minimal treatment, and then use it for recharging or even for agriculture. So this program has just started. So but again, it's very timely now. Let's talk a little bit about the current context, which Pradeep very eloquently described. So we're all in the middle of a pandemic. We're all working to a large extent virtually. And the issue of water is central to the current situation for many respects. And if you just look at hand washing with soap, which is a practice many of us have been promoting for the last 20 years, with some success, but now it's uppermost on the agenda. So for that, you need water. So one question which is posed to me very often, if you are going to wash your hands with soap 4 or 5 times a day, where is that extra water coming from? And so again, the importance of the Jal Jeevan mission is critical. And so, we're having a series of meetings with state governments, because as you know, in India, water is a state subject under our constitution. So the state governments have to implement, and the central government supports them, gives some funding support, policy framework, and technology support. So this is going to be a very important input into washing your hands with soap. But again, if you just look at the soap part, a lot of soap, there's probably going to be more soap generated out of hand washing with soap. So the disposal of that soap, if a lot of soap goes into our water bodies, into our rivers, we'll have to rethink that whole process. How can we do it in the least environmentally damaging way? I think that's an issue which is important for people to consider going forward, particularly in the new normal now, which is where this simple act of washing your hands with soap is going to become very, very critical. Then if you look at again disinfecting different systems, again all of us now are getting used to wearing masks. A lot of them are plastic. We are trying to encourage simple cloth masks which can be rewashed, so you don't burden the environment further. But a lot of waste, plastic waste, is going to be generated. And how are we going to deal with that again is another issue which we need to consider. We are trying to issue some simple guidelines to our state governments in terms of what are good practices in disposal of plastic masks. And so that's another issue which we need to consider. And then just the use of sanitizer, which everyone now, the production is stepped up. Many alcohol making units which were shut down started making disinfectant. So many shifts have taken place in both demand and in supply and in production. So I think these are all very important issues which we need to consider. Hopefully some of them can be discussed today by all you technical experts. and we have another few webinars to go where some other issues related to the new normal can come up. But let me just add a couple of points at the end, is that provision of clean water. It's an SDG goal. It's a national goal in India. This is going to become very, very high priority. But we need to understand that working, even if you're talking of construction activities in this sector, is again got to be done in a safe manner. And so guidelines have been developed. We are working with our partners in India like UNICEF, who have given us some advice in terms of what are safe practices beyond wearing a mask, wearing gloves, wearing boots. How do you practice social distancing in a practical way when you're constructing water supply systems, when you're doing water conservation, when you're doing groundwater recharge? So I think all these issues are going to become extremely important going forward. And any suggestions which any of you have towards this direction would be very welcome. I'd like to stop here because we need to hear from all of you. But I wanted to thank Professor Pradeep and IIT Madras for giving me this opportunity. I'd like to congratulate them for organizing this webinar at a very timely situation during this pandemic. And I'm looking forward to listening to all of you, and hopefully we can take some of these collaborations going forward. Thank you. Over to you, Professor Pradeep.
Ramya, the next speaker, we will get started.
Yes, sir. I invite Professor G. Arun Kumar. I don't think I need to introduce him. He's a very reputed virologist. And I hand over to you, sir.
Okay, thank you. Thank you, Professor Pradeep and Sri Iyer for this opportunity. So, Ramya, you will put up the slides. So the next few minutes, I thought I'll just take you through a few aspects of disinfection and also into the context of COVID-19 or the SARS coronavirus too. So, people have a lot of confusions, and many times people are trying to overdo, disinfection and, create a lot of excess disinfectants coming into the environment, etc. So to understand a little bit, let us go to the next slide, please.
I would like to mention that Dr. Anand Kumar national program,
okay. Yeah.
The push, the initiative against the
Yes.
and the chikungunya and all that.
Yeah.
Salutations to you. Please proceed.
Yeah. Sure. So just to understand some of the terms, because we are going to talk about this, is we repeatedly hear these terms like sterilization, disinfection, etc. The sterilization is basically a process which eliminates all forms of microbial life, whereas disinfection is a process where you eliminate many or all pathogenic microorganisms. It doesn't eliminate every life. So, and cleaning means it is just removal of visible soil. And decontamination, this is very, very important in today's scenario, because the materials from these hospitals, etc., has to be freed from pathogenic microorganisms before it can be handed over for discarding or it can be handled. So this is just to tell you about some of the terms. Next slide. Could you move on to the next slide? Okay.
Yes, sir. There seems to be a lag.
So a few more points to come here. Yes. So we call anything which kills the germs as a germicide, and disinfectant is basically a germicide. But when we mention as disinfectant, we indent that this is used or applied on inanimate objects. Whereas we use a term called as antiseptic. This is a germicide, or which can be applied safely on living tissue or skin. So basically, every disinfectant cannot be applied on human body or live tissues. So this is an important thing, because recent times we can see many places that people spraying disinfectants, which is meant for inanimate objects, to human beings. This is not required. This is, most of the time, it is an overdue. So all disinfectants are not antiseptics. So that is very, very important to remember. So we can use only certain disinfectants for use on human body or human skin. Yeah, so that has to be understood. Next slide. So there are several ways you can apply this disinfection. So one of there could be physical methods and chemical methods. So physical methods, again, recent times we would have, many people have heard about ultraviolet light, etc. Yes, ultraviolet light can destroy the nucleic acid of the virus, but ultraviolet light doesn't have the capacity to penetrate. So this can be used only for a surface cleaning in laboratory, etc. Not for use in places where human beings are there, like at home or rooms where patients are housed. These are the places where ultraviolet light is not useful. In fact, it is harmful, because ultraviolet light also, the extended exposure can be harmful to human beings. So this can be used, but in a very, very limited surface sterilizations it can be, or disinfection it can be used. Then we have a number of chemicals. These chemicals, are some of the chemicals are can be used even on human skin or tissue. So there are different levels of disinfectants. There are low-level disinfectants which can kill some amount of bacteria and some viruses, whereas intermediate disinfectants, which we measure in terms of whether it is able to destroy tuberculosis, Mycobacterium tuberculosis, the causative agent of TB. And high-level disinfectants, they are the disinfectants or chemicals which can destroy even up to spores. That means almost like sterilization. It can remove or destroy almost all type of life, including the resistant bacterial spores. So they are high-level disinfectants. Some of the low-level disinfectants, that is the one which we commonly use. They are alcohols. 70% ethyl alcohol is one of the commonest safely used disinfectant. That is also an antiseptic that can be safely applied on human skin. Of course, we use a lot of chlorine, halogens. Chlorines used in water for water, disinfectants, and soap. These comes under this low-level disinfectants. The soap, we will explain a little later how exactly it works with COVID. Then, of course, we have high-level disinfectants. One of the older one is the aldehydes, formaldehyde. Of course, we know that the environment, so people are trying to reduce the use of formaldehyde, but they are extensively used in laboratories to disinfect in laboratory, disinfect hospitals, operation theaters, etc. But now we have another better technology coming up, where vaporized hydrogen peroxide. Vaporized hydrogen peroxide, one advantage with vaporized hydrogen peroxide is that there is no residue. There is no residue, very little water is used, and there is no residue at the end of it. So that has been used in hospitals, particularly in hospital wards. Decontamination or disinfection, hydrogen peroxide is a very, very good solution because it doesn't leave any residue. Ethylene oxide, but ethylene oxide is not used, mainly used for disinfecting plastics or sterilizing plastics. Disposable syringe, etc., are being actually sterilized by ethylene oxide. Ethylene oxide can penetrate through the cover and can sterilize too. So these are different levels. So most of the hand wash, etc., are lower level disinfectants. So they reduce the amount of organisms or microorganisms in your hand. But one thing we have to remember is that these disinfectants, if they want to properly act, the organic material or organic contamination should be very less. So we should remove organic contamination, because presence of organic materials with great efficiency any of these disinfectants. Go to the next slide. Yeah, so coming down to the SARS coronavirus. So to understand a little bit peculiarity of this virus, first of all, virus, we really don't consider them as live when outside the body, because they show the signs of life only when they are inside a living cell. So outside the body, they can remain as like an inert material cell. So this coronavirus is a very small particle. It is 70 to 90 nanometer. Very minimum material they have. They have a nucleic acid which is made up of RNA. You can see as a coil, and which is covered by a protein coat as well as an envelope. So there's a protein coat and there was an envelope. This envelope is made up of lipids, and this lipid also contains some proteins which is projecting outside. So they are called as the spike proteins. So this lipid layer is our target for disinfection, particularly the chemical disinfection. That our target is this lipid layer, because this lipid layer holds the proteins or protein spikes which the virus uses to anchor to the live cells or cells for the entry. So if you destroy or disrupt this envelope, the virus will not be able to attach itself to the cell. So if the virus is not able to attach to a cell, then virus is not able to enter the cell. So most of our focus is on disrupting this envelope. You can also, damage the nucleic acid. So if you use a UV light, basically they damage the nucleic acid, whereas the chemical disinfectants mostly focus on the envelope. The lipid envelope can be disrupted. So the soap also acts exactly on this envelope, because soap forms a micelle. When they form the micelle, they cause pores on this envelope, this lipid envelope. It causes pores, and the integrity of the virus goes, so that the virus becomes non-infectious. So to make the virus non-infectious, if you disrupt the envelope, the virus becomes non-infectious. Next slide. So how the SARS coronavirus is transmitted, because that is also an important aspect to understand. So the route of entry of this virus, or how a person gets infected, most of the time the person gets infected when the virus enters through the respiratory tract. But some reports are there, they can also enter through the corneal or eye. If the eye protection is not there, through the corneal mucosa also the virus can enter. But most of the time virus enters through the respiratory tract. So how it is transmitted from one person to another? Lot of studies have now revealed that the major route or mode of transmission is droplet. So when we talk, the saliva, the droplet coming out from our mouth can enter into another person. So because of this droplet transmission, you really need the person to be together for some time. So a considerable time, people have to be together very near, within 1 meter distance, for the effective or efficient transmission to happen. Initially, there were a lot of talks about the virus transmitting through air. Virus is not transmitting through air. All the studies have really showed that there is no aerosol transmission. So the virus is not moving through the air like measles virus. Measles virus can infect a person even 3 meter distance, because it moves through the very small aerosols. Whereas here it transmits through the droplets. And the another point where disinfection very important is that sometimes these droplets can fall on inanimate objects, and it can remain there, and the people can touch those inanimate surfaces, contaminated surfaces, and they can take it to the...
Little bit faster, Dr. Arun.
Oh, it's obvious. So from the inanimate objects, the virus can get transferred to the nose if you frequently touch the face. So that is how the virus is transmitted. So the way to break the chain, one is the hand washing, and the other one is using disinfecting the inanimate objects. So when we do this, we have to do optimally using appropriate disinfectants, and we should try to avoid overdoing by pouring disinfectants on humans and pouring disinfectants into air and road, etc. Okay, this completes my talk. Thank you.
Very nice to see that our attendance has gone to 657.
Yes, sir. Now I invite Professor Jayanta Halda to continue with this talk. So.
Thank you. Before I start, it's a great pleasure to have me here, and I am happy that I am also part of this series, and like to thank Professor Pradeep for organizing this conference. And today what I am going to talk to you about how to disinfect the surfaces in this time of this coronavirus outbreak. Could you please go to the next slide? Yeah, in the previous speaker already has mentioned some of these points that I like to again highlight, saying that this SARS-CoV-2 is an enveloped virus of RNA virus, and the size of 60 to 140 nanometer, and it's been mainly transmitted through droplets from human to human. Transmission happen, and also through the inanimate surface that he mentioned. But the virus also have been seen to survive in aerosol as well. And it is, as of today, it is unfortunate that more than 3.7 million people got this infection in 187 countries, and already claim more than 260,000 people globally. So this is a serious issue about this pandemic that is going on, and we don't know at least what is going to be the fate in future. Please go to the next slide, please. So it has been found that this SARS-CoV-2 virus can survive in different surfaces like tissue paper or this different type of cardboard, which 3 to 4 hours it can survive. On stainless steel, it can survive even up to 7 days. Plastic and also different currency, it can survive 4 to 5 days. And also different type of PP materials, the health person, even we use, or any doctor and other patients use, it can survive even more than 7 days. Therefore, that in a hospital, that this kind of surfaces, different places are there, and not only in hospital, in the community also. This type of viruses can accumulate onto the various this kind of surface. It can stay there, and we can get the infection once we can't come contact with this type of contaminated surfaces. Therefore, it will be interesting if you how to clean these surfaces. That is the major concern. How to keep it sterile, these surfaces, so that we don't get the infection. If you go to the next slide, where there are two kind of way of you can clean these surfaces. One, some of the points already been discussed. That if this type of viruses or any other organism like bacteria, fungi get accommodated onto the surfaces, so we have a different type of compounds which can be used to clean it up. And that is one strategy. Another strategy, is it possible to make the surfaces antimicrobial, so that any times this virus or other pathogens get deposited onto the surfaces, it should be able to kill its own, so that the surface is always sterile, so that you don't get this type of infection by touching that surface, because virus or pathogens cannot survive onto this surface. So these two strategies can be adopted. The first one, as I said, many people already mentioned how to clean the surfaces. One of the thing is using various type of soaps, and which we always using washing hands with different kind of soaps, and similar soap solution can be used to clean the surfaces. Various type of alcohol like ethanol, 70% ethanol also been mentioned previously, or isopropanol can be used to not only sterilize our hands, but also can be different surfaces, different type of organic or compounds or inorganic compound or oxidizing compound like bleaching solutions, the sodium hydrochloride solution or chlorine solution, or highly oxidizing agent like hydrogen peroxide being used to clean the surfaces. Or you can clean the surface by treating with UV. But many of these surfaces, as mentioned, Mr. Iyer, that if you are washing so many times hand with water and many other surfaces, you are overusing this water, and that is a huge concern about. And there are many of these reagents that you mentioned for cleaning the surface are highly toxic and also the corrosive. It cannot be used for different surfaces. It can spoil the surfaces. Therefore, there will be alternate option whether we can have make the surfaces antimicrobial, as I said, and it can take care of its own. So if you go to the next slide, where you have and where we actually contribute in our lab at GNCS at Bangalore, where we try to make these surfaces antimicrobial. And there are different strategy approaches that can be, one can take it, and we have tried to take it to these different approaches. The first one, I said that release-based mechanism. So you have, we know, different type of like nanoparticle, different quaternary ammonium compound that is just mentioned as a soap. Those molecules can be impregnated within the surfaces, and these molecules can release from the surface and kill the pathogens, virus or bacteria once come in contact with that, right? So this is we call it release-based mechanism. And we have the last couple of years, we have developed different kind of like surfactant, biodegradable surfactant or detergent. We have developed, and we shown that it can highly effective of killing different type of pathogens. And that one, this not only can be make it solution and clean the like a soap, but it can be clean the surfaces as well. Second approach that we have taken, we develop different type water insoluble polymer, where this can be solubilized different organic solvent, and you take the solution, coat it onto the different surfaces. And as soon as bacteria or virus or any kind of pathogen get deposited onto these surfaces, it can kill it, right? And therefore, this is called contact-based mechanism, because virus or these pathogens get deposited onto the surfaces and kill the pathogen. So we call it as a contact, and we have shown, we have developed different kind of materials, polymeric materials. We also try to combine this release-based mechanism and contact-based mechanism together in one system, and where both they can be used, and it can be even more effective, which is number C. And these two mechanisms, as I said, B and C, this is technology where it's been used as a non-covalent attachment of the polymer or polymer inorganic nanocomposite onto the surfaces. We also developed recently contact-based mechanism with the covalent modification. We have taken different kind of surfaces like textile, plastic, polyurethane, different kind of polymeric surfaces. And we have developed molecules which can be coated onto this covalent, attached onto these surfaces. And we could show that once bacteria, virus, or fungi get attached onto this surface, it can kill it. Okay. And more specifically, if you go to the next slide, where we have shown that these molecules can be solubilized in organic solvent or water, and then you take the surfaces and dip it into the solution, or spray and swat onto the surfaces, and then UV irradiate for some time. So this compound get attached onto the surfaces, and then you wash it, and then take these surfaces, and then when we have tested against bacteria, it kills completely the virus, bacteria, different kind of bacteria. It kills fungi, different kind of fungi, and also we have shown that these surfaces kill even the influenza virus. Okay, two different strains of the influenza virus. And we are right now trying to test this type of surface, various type of textile, and also the PPP surfaces, whether it can kill the coronavirus is not, and we are waiting for the result. And with that, I said this type of strategy, that means the coating strategy, can be taken to protect against this coronavirus outbreak and put it onto various surfaces, and not only save the healthcare person, also the common people. And with that, I like to thanks. If you go to next slide, I like to thanks students and also the funding agency, and also like to thank all of you for kind attention. Thank you very much.
Thank you, Jayant.
Thank you, Professor. And I would like to apologize that I'm not giving lengthy introductions to our speakers and panels, purely because of want of time. But the number of participants at 670 is evident to their expertise. So without taking much of your time, I invite Dr. Majumdar to take over. So.
Good evening. And I'm very happy that got this opportunity. Although I might be a little disappointing because I'm speaking in place of Dr. Bindeshwar Pathak, an eminent personality and eminent person. But anyway, so we'll be talking about the topic which has been assigned, that is sanitation during COVID. Should we be concerned? Yes, we need to be concerned. As we have listened to the speakers so far, we definitely need to be very, very concerned. So here I'll deal with the situation from the sanitation point of view. So what are the difficulties, what are the challenges? And particularly the challenges are from the very densely populated low income areas. Next slide, please. Yeah, so sanitation in densely populated low income areas, it's already a challenge. Now, why it is a challenge? Because space and affordability are the main constraints. Here, I'd like to mention that Sulabh Sauchalay, the twin leach pit composting toilet invented by Dr. Bindeshwar Pathak, is one of the most affordable household toilet system for India, considering the requirement of space, water use, cost, and ease of dislodging or emptying the pits. But in very dense slums, even this much of space is difficult to get. Next slide, please. For such situations, one can think about cluster toilets for a couple of households together, 2 community toilet complexes for the whole or part of the slum. Now, those facilities are designed with a certain peak and lean timings. Now, with the COVID coming in, we have a great concern about the timing because we have to maintain social distancing. And at the same time, we have to do a lot of cleaning and disinfection, right? So the number of persons who can use a particular community toilet cubicle would drastically come down. Now, that would mean that we need a change in the planning. You see, because earlier, for example, we used to take 50 persons per toilet cubicle in a public space where there could be people coming in almost 24 hours, like a bus stop or a railway station and places like that. But with these things, it would drastically change. So the planning element has to be redesigned, recast. So that means more investment, because the number of seats or the number of persons per seat would drastically reduce. So therefore, more space would be required, more money would be required. This is a big challenge. Apart from that, meticulous sanitation of the toilet cubicle is a huge challenge. Now, we had a very learned speakers earlier who talked about the infection and how it happens. Now here, maybe I can learn more from them. See, suppose there is a small cubicle of about 2 to 3 cubic meter volume, and the ventilation is not very good because it's a public toilet cubicle. One person goes in, comes out. After that, how much time can you give for cleaning it? Number one. Number two, that 2 to 3 cubic meter of air, which is still there inside, how to move it out? Because there might be some droplets for a couple of seconds. Because in public toilets, we see that during peak periods, there is a rush. So, I mean, just one person comes out and the other just gets in. So the time for cleaning is almost, I mean, it's a difficult challenge. So these things need to be looked into. I think this cleaning of the volume of air would be a challenge which we need to look into. We are also looking at it, and we are also trying to develop some SOPs so that our own toilet complexes, they can be made safer. And then, maintaining strict norms about social distancing, hand washing, this is also a challenge in a public toilet complex. Maybe there can be systems of checking the people who are coming in, meaning check their temperature and so on. So these can be the additionalities which have to be there in future. Next, please. Next slide, please. Yeah. Now, next comes the appropriate disposal of sewage or the human waste from such facilities, which is crucial. Now, here I'm not discussing about the normal city. I'm discussing about a slum, a densely populated slum like Dharavi in Mumbai, or there are so many in Delhi. So I'm talking of them. Many of them are not sewered. So how do you dispose of the sewage? In unsewered area, a biogas plant could be an ideal one for better utilization of the sewage, because there would be resource recovery in terms of sludge manure, then bioenergy in terms of biogas, which can be converted into electrical power if required, treated effluent for irrigation and so on. We had, Sulabh International and the guidance of Dr. Pathak had developed a particular design for community toilet linked biogas plant, which was quite successful. So that kind of solution can be put in. However, more land and more funds would be required if we compare with a traditional 2 to 3 chamber septic tanks. But if you have a septic tank, the issue of dislodging and other contamination issues, and the water also, the effluent water which comes out, is not safe. All of us, we know about that. Since time is short, so I'm not going to speak about it in more detail. So that comparison had to be made, but possibly, if possible, a biogas plant would be a better solution. Then comes the issue of the sanitation workers. Now, sanitation workers on ground and in plants, for example, a waste management plant or a sewage treatment plant, they have also to be thought about, because they have their personal safety issues. It's not easy. You see, if one works for 8 hours, even 10 hours, it's not easy. Going to a place with purported infection for let's say 2 hours or 1 hour is relatively simple. But to go to a place, work there for 7 hours, 8 hours, every day, it's a big challenge. So that means more safety measures have to be there, much more than actually required. Next slide, please. Our city level sanitation situation also needs to be looked into, because this is a time of rethinking, particularly because we are handling our sewer network and STPs also. These are being, in some countries, some work is being done, whether the sewage is also affected with coronavirus. I think some work is being done in Schiphol Airport in Amsterdam. Some other work is also being done. So till all those things are known properly, we have to respect with more safety. So apart from this issue of safety, since this is a time, because I feel, you see, this is a time to, this is an opportunity to reboot our systems and to reset our priorities, because we have seen the impact on nature. We have seen the impact on air quality. We have seen the impact on river water. So why not take this opportunity to reboot system? So coming to the STP or the sewage treatment plant, if you visit a sewage treatment plant, very few would be neatly positioned. Most of them are pretty scattered. And the sewage after the treatment, neither the water or the effluent water is properly used, nor the biogas is properly used. So therefore, I'd like to mention here that we should look into these planning issues at this very point, which also includes optimal land use. Apart from use of the biogas in a sewage treatment plant, huge quantity is generated. So why not use it instead of flaring it? So that can be used more fruitfully. Similarly, the future sewage treatment plants and any upgradation should be in a way that the land use is more effectively done. Often huge areas are retained and underutilized. I have visited so many of sewage treatment plants. I have worked with a couple of them, and that has been my, I mean, you feel a little sorry about that. Next slide, please.
Can we close this, Dr. Mashin?
Yeah, this is, I think this one or the next is the last. PPE has suddenly descended on our lives in a big way. So from the individual households to the public spaces, and more seriously for the corona warriors. That means the sanitation workers, law enforcement personnel, healthcare personnel. So the situation is completely different for the PPE. But as we had just seen, how long the virus can survive on even a face mask, how do you dispose of it? See, actually in the BIS, we are trying to have some standards for this also, but that is an ongoing process, may take months. But in the meanwhile, how do we dispose of the huge quantity of the PPEs of different types? Now, these would be different. The household PPEs would be different, household face masks would be different, whereas in a hospital or healthcare worker, it would be a completely different issue. But we need solutions. Of course, we do have our rules and regulations, like the biomedical waste management rules and the solid waste management rules. We have three distinctions there: wet, dry, and the household hazardous waste. So those need to be looked into in a more meticulous way, with understanding and with honesty. And let us hope that we would, get over this in a better way, and we will come out better than what we are now. Thank you very much.
Let me proceed.
Thank you, sir. I request Mr. Nicholas Osborne, Chief of WASH, UNICEF India, to take over. So.
Good evening, everyone. Very pleased to be here. I hope you can hear me well. And well done to Professor Pradeep. 662 people, that's quite impressive. All right, so I'm going to disappoint you a little bit as well. I'm not a doctor, I'm an engineer and architect. And as you will see, I will go down to very basic application of the in-depth knowledge that we could benefit from till now during this call. So yeah, my name is Nicolas. I'm the Chief of Water, Sanitation and Hygiene Program for UNICEF India. I've been working in the country for the past 3.5 years now. So next slide, please. All right, so a quick outline of this presentation. I'll give a brief overview of what it means to ensure continuity of WASH services with the new normal under COVID. And I'll present briefly the new government, the sector advisory to ensure the continuity of services, which are really important, specifying the budgets and what needs to be done. And then what does it take to invest in capacity development of WASH service providers or functionaries to operate under the new normal. Water and sanitation services cannot be interrupted, and give some example of safety precautions, very basic things that can be implemented right now. Next, please. So what's the context that we know of? So we are facing travel restrictions, and so there is in many areas a scarcity of service providers, and which is hindering the continuity of the service. And now that we are starting the hot and dry season in many states, this is putting many vulnerable communities under threat. As we know, during the summer season, the groundwater will go through depletion, and many of the hand pumps will be out of service. And then we have an increased demand for water supply for quarantine facilities, sanitation work, and also urban slums and many areas, because we need water to maintain cleanliness. And we are facing at the same time a lack of staff to identify the specific issues, have monitoring system to be able to act and ensure the continuity of the services. Next, please. So that's quite important. Water and sanitation and hygiene is considered in India under the category of emergency services. So that's good. It gives to the sector the traction and scope that is required to contribute to prevent the spread of COVID. As you know, you heard about the Jal Jeevan mission, and the good news is that the priority is household water connections rather than stand post, and which is in terms of prevention of disease transmission much better. Also, the government authorized 25% use of the flexi funds under the two flagship schemes, the Jal Jeevan mission and the Swachh Bharat mission, and to be used for the continuity of wash services, including operation maintenance, water testing, and in support to quarantine centers and shelters. So there were specific advisories issued under the leadership of Mr. Iyer on the, that were sent to states to authorize the use of funds, and this was done at the early stage so that there is no financial constraint to support those priorities. Next, please. All right, so now we are entering in the complex part, I mean the difficult part. So in order to ensure the continuity of the services with enough safety and security, there is a massive effort from all of us, development partners, government, academia, to support the capacity development of WASH professionals on physical distancing, regular hand washing with soap, and wearing simple protective equipments at all time. It requires a lot of capacity developments of elected representatives for supportive supervision and ensuring the adherence to safety precautions by service providers. So it's not just about a hard enforcement with the stick, it's also about the incentives and the right payments for the service providers to take the risk to continue the services and do it well. No, can you stay on that one, please? For this, it requires a lot of regular repeated communication and activities for safety precaution and careful planning and hand-holding support to monitor and track the repairs. So just pause it here because I will go fast on the next slide. Let's face it, I'm French, and I think we share a cultural personality like Indians. We are not the most disciplined person in the world, a bit like in India. We are not like Germans where, you know, when there is an instruction from the government, people hear it and apply it. So all this awareness raising and enforcement will require a lot of efforts. Imagine every day I'll show you what needs to be done on a regular basis, and making this happen in India is a massive investment. At the same time, there is a massive return on investment. Let's face it, this crisis will continue until we have a vaccine available for everyone. We're talking about the time frame of 18 to 24 months, but this investment is not lost. We have a good evidence from very poor countries in Africa, such as Sierra Leone, DRC, where they invested on these habits among the sanitation workers and the health workers to face the outbreaks of Ebola and other crises, and it's paying today. So this investment in India is not just for 2 years. It's to go much beyond. Let's not forget that in India, just to give in 2015, there were 117,000 children under 5 years old dying because of diarrheal disease, which are preventable disease. So again, all this investment will massively pay in terms of public health and economic growth. Next, please. So thank you. So this is very obvious, and I won't take a lot of time, but it's about, you know, those habits for the sanitation workers. It starts when going out of home, hand washing, and making sure that using separate clothes and footwear, covering the mouth and nose with mask and glasses as possible, and not using the same mask, and also for transportation, simple things like avoiding pillion riders on cycle and motorbikes. Next. So when at work, how to ensure those precautions. We have to maintain this physical distancing while collecting water, keeping the distance of 1 meter minimum between the workers, and then disinfecting the objects that you are in contact with, be it the starter switch, the valves, and so on and so forth, and using gloves for heavy duty. And then, of course, hand washing with soap, hand washing with soap, hand washing with soap. Next. So still when at work, so you know, you can imagine the quantity of supplies of disinfectant that will be required, you know, in order to be compliant with those basic measures. So this is about disinfecting the area after completion of the repair, clean and disinfect the tools with hypochlorite solutions, and for any other item after the use, and after the repairs as well of other components, especially on water supply. We could hear in previous presentation how long the virus can stay on surfaces, on water, on wastewater. So this disinfection is really important. Next.
You have to close.
Yes, I have to close. I have a few more seconds. So look, go to the next then if I don't have time. Next. So, and then when coming back home. So for the sake of the audience, all of those safety measures were put into specific PowerPoints that are open source, that were given to the government. We can give it to you, Professor Pradeep, for dissemination. And those specific PowerPoints are used to train the service providers, the water and sanitation service providers, to form those habits. So that's, again, a very short and pragmatical presentation on what it will take to ensure the safety and the continuity of essential water and sanitation services. Thank you.
Thank you, Nicola. Now I invite Dr. Sandhya Srivastava, Director from Bhavan's Research Center, to take over. Madam.
Hello, am I audible?
Yes, ma'am.
So good evening, everyone. And I hope everybody is taking precautions and remaining safe during this challenging time. I really thank ICCW for making this webinar happen and having me on this program. Can I have my first slide, please? The next one. So, most of this has been covered by Dr. Arun in the first slide. Only a couple of points I would like to mention here about the cleaning agents, sanitizers, and disinfection. The cleaning agents are not regulated, though they are not regulated in terms of germ removal, though they do remove germs by about 97 to 99%. Sanitizers and disinfectants are regulated by regulatory bodies, and they are expected to reduce the germ 3 log or 4 logs. Between the sanitizers and disinfectants, the disinfectants are the harsher ones because they are used in hospitals, public health services, whereas sanitizers are generally used to improve sanitary conditions. So this is a very broad difference, though there is always an overlap between disinfectant and sanitizers. Next slide, please. So I'll be covering this topic more from a microbiologist point of view and environmentalist point of view. So this is a cursory list of disinfectants that are used. Most of it everybody is familiar with. At this point of time, we are all focusing on COVID virus, and all these disinfectants are capable of inactivating the SARS coronavirus. So we are in that happy space with the disinfectants that are enlisted here. And believe me, there are huge number of variants in each of these groups. Chemists have done great job to create these variants. The advantage of variants is that you have lots of options to be used for the disinfectant purposes. The concerns about disinfectants, of course, the purpose is to take care of the germs, but the concerns over disinfectants are three. One is about the human health, impact on human health. Second is impact on environment. And third is impact on the microbes. Now, human health, of course, I am not the competent person to talk about, but certainly in the environment, usage of disinfectants. We just heard from Nicholas about the volumes that we have to use hypochlorite and other disinfectants for actually community cleaning. And we are all using it very, very rampantly these days. So, but if you look at these disinfectants, the list of these, out of these, phenolics, the halogens and the quartz are the ones that actually go into the wastewater system. And unfortunately, these are the ones which are being used most commonly. So yes, usage of disinfectant and more usage of disinfectants are going to impact the environmental systems. The other aspect is with respect to microbes. We are all aware about the antibiotic resistance of the microbes. And we are all worried about whether the same way, if we are using disinfectants to this large extent, are we going the same way as the antibiotic resistance? So these are some of the challenges that is going to be faced by us today and tomorrow, and we don't have lots of answers to it. The next slide, Remya. So welcome to the new normal. It's a new word. Everybody is adapting to it. So there are no two ways about it. We have to adapt to the new normal. But what we need to do in the new normal are something very logical. I'm not going to tell you something as a rocket science, but certain things which I think has to be brought to people's attention is, one, of course, we need to practice hygiene to minimize use of biocides. And number two, very important, is follow instructions for correct usage of these biocides. So what happens is that when you're using the biocide, two very important parameters have to be very clear for anybody who uses it. One is the concentration and second is the contact time. And if we are using it at high concentration, we are overusing the biocide. If we are using at low concentration, we are getting a false sense of security. And therefore, this is important for everybody to understand. And if we are using it, fine. If somebody else is using it, those kinds of right instructions need to be given. Plus, we have to focus on devising tools and methods to optimize use of biocides. And can we, like, for example, can we modify the dispensers to just deliver the adequate amount of soap or sanitizer? Can we practice hand dip sanitizers or reuse the disinfectants? These are certain answers that we need to seek with time. Next slide, Rema. So this is going to be my last slide. Here, what I'm trying to focus is how we need to take new research and regulatories together to focus on optimum use of disinfectants. So COVID-19 may not be the last pandemic. Hopefully it is, but we don't know. But besides COVID-19, there are besides SARS-CoV-2, there are lots of other infectious agents with which we are groping today, and we will be groping even if the COVID incidence gets over. And therefore, usage of disinfectants and sanitizers are going to be a part of our life for good, I would say. However, we need to focus on research for a few things which comes to my mind at this point of time. One is that we need to study the impact of residual disinfectants in air, water, wastewater. Like we are seeing what is happening to our drinking water with usage of antibiotics, with uses of pesticides, organic, inorganic. huge amount of concern. So we do not want to add, it's already there, but now with much of usage, where we are standing with respect to the wastewater. Number two is, how are the microbes responding to the disinfectants? Now, there are reports about disinfectants carrying some of the mutants, the microbes carrying some of the mutants to disinfectants, but most of these reports are being extrapolated from antibiotics, which may not be the right thing to do. So specific research for disinfectant resistance has to be taken up. And number three is about the methodology for evaluation of new applications. So we are getting a lot of requests, somebody asking, okay, I have a disinfectant, will it be able to clean my sofa? Will it be able to clean my handbag? So there is no protocol for these. These are all new applications. There are certain protocols, of course, American and European protocols, where surface cleaning disinfectants are very well defined. But for new applications, there are very, very few protocols. So we will have to work on these protocols and design these protocols. And of course, all these things will have to work with the regulatories, international as well as our national regulatory systems. I am not sure what kind of specifications we have under India regulations. Of course, we follow the EPA and FDA regulations, but we need to have our own regulations also, specifications, standardization, especially based on the risk assessment. For example, a simple example I can give, should I be using the same concentration of disinfectant that I use in my toilet to clean my table? I don't know. So we need to actually evaluate the risk, ensure we are using optimum concentration for the right kind of use, which will reduce or which will be making our activity with the disinfectant more effective, rather than just assuming. Otherwise, we will be under very, very wrong kind of assumptions that, okay, we are using disinfectant, but whether it's doing its job or not, I'm not very sure. So last slide, Ramya. Thank you very much. Let's all strive for health and protection.
Ramya, I will take 1 second just to inform the audience here that these are the very best people that the country has got in these areas. And it was a fantastic session here. Sandhya especially, she has all the years of wisdom with her, a lifetime spending on disinfection. She has brought that in. Thank you very much. Let's move on to the panel discussion. Ramya.
Thank you, ma'am, and thank you, Professor. Yeah, let me just prompt the participants. Get ready for your Q&A. Kindly post your questions in the Q&A box, and along with your name and city, and specifically addressing it to the panelist or speaker. Now I call upon our moderator, Dr. TNVV Rao. He also needs no introduction. He's our technical advisor at ICCW with around 30 years of experience in water technologies. So I invite Dr. Rao to moderate the panel discussion. So
we are 10 minutes delayed. Let me also say that.
Okay. Am I on, Ramya?
Hello.
Yes, sir.
Or Dr. TNVV Rao?
Yeah, Dr. Rao will introduce you.
Yeah, good morning, good afternoon, and good evening to all the participants in this international webinar from various geographies. Now, the interesting part is the panel discussion, and we have 3 panelists, eminent panelists. The first panelist I would like to introduce Mr. Ravindra Sevak, and you can see on the screen his credentials, and he's very experienced, and he now presently heading Safe Water Network in India. And I request Mr. Sevak to proceed for his views.
Namaskar. My compliments to the IIT Madras and Professor Pradeep and ICCW, as well as Dr. TNVV Rao, in organizing this wonderful session. 600 plus participants with scintillating presenters. I will keep my address very short. We are dispensing water to 1.2 million people through our 330 water stations in rural and urban locations. In order to protect the people, we did social distancing, hand washing, masks on, specs on for the dispensing operator, etc. In order to clean the workplaces, we have institutionalized the wipe down protocols and all the touch points of wipe clean. And in our, at least water stations, we have touchless RFID cards and water ATMs for 24/7 dispensing. And during the lockdown, even on the day when Prime Minister Sir asked the first day of lockdown, our volumes went double because we were able to maintain these things right from the beginning in our systems so that whenever there is a need, they can service very high degree of seasonality. How do we use the disinfection on the people is basically soap or sanitizer. But whenever it comes to the products or surfaces, we use 500 ppm to 1000 ppm. We prescribe 1000 ppm of chlorine solution to sanitize. We require for each station additional investment of almost 30,000 rupees, which requires hand wash stations as well as infrared thermometer. And annual expenditure is almost 10,000 rupees. But we would be looking forward to affordable yet environment friendly soap solutions so that we can provide those at each one of the water dispensing stations. We also do the assembly. So what happens is whatever is the material that is coming in has a wipe down protocol, not only for the case outside, but also for the products that come out of it. And people who are using it are using completely masks and goggles all the time and gloves while assembling it. And they take care while assembling it. But we also instruct the people who are taking it at their end to either keep it in isolation for 7 days or do the wipe down protocol at the receiving end. This is going to have a lot of impact on water, both in sewage as well as in water bodies. There have been research where the COVID has been found both in sewage and water bodies already. It's not researched yet whether that is going to impact the health of the people. And hence, chlorination of drinking water at a very minuscule level is must so that people, whoever are consuming water, are safe till such time further research is done. However, we need to see that all the employers and employee both take the responsibility together and work it out so that both people who are working and people who are consuming water and users, they are all safe. You have to do all training digitally. You have to dispense water digitally. You have to interact the money transactions digitally, where B2B or C2B, meaning consumer to the business and business to the customers or the vendors, has to be all digitally closed. So in end, I will once again thank you all. And if there are any questions or suggestions, we are willing to take it. Thank you.
Thank you very much, Sir Ravindra Sevak. Now I would like to introduce Dr. Raja Biswas. He is an Associate Professor at Amruta Center for Nanosciences. And he is a very eminent professor, and I would request him to give his talk now, his views. Hello, Dr. Raja Biswas.
You can hear me?
Please proceed.
You can hear.
Hello. You can hear me?
Yes, we can hear you. Proceed.
Hello.
So as this meeting is related to the management of water, I made some quick literature search and found out that some reports published from China itself, the Shanghai University of China and WHO also cited those reports, which showed that the COVID virus can survive in wastewater for almost 3 to 7 days. So that indicates that there is a need to treat water, especially in the containment zone. Also, there may be a requirement to do frequent water sampling or wastewater sampling from the containment zone to see the virus is present in the water or not. So I like to draw your attention to another report published in 2003. This was not this COVID. This was the SARS virus. In Hong Kong, there's a 50-story building where 342 people got infected with SARS, and out of them, 42 people died. So that happened because of the leakage through the plumbing system. And later, the WHO reported that in Hong Kong, that incident happened, and 42 people died because there was a leakage from the plumbing, and the water droplets coming out from the pipes infected a large number of people in the community. So therefore, there is a need to do a water sampling, wastewater sampling, trying to see that COVID is present or not in the areas of the containment zone. And if so, we need to treat those wastewater immediately. And I think most of the information what I have collected in the literature, my previous speakers have already explained in details.
Ramya, can we proceed further?
Yeah. Our next speaker, Professor Venkatesh Tupil, and he is an eminent professor, emeritus professor from St. John's Medical College. He is also called as Leadman, and he leads so many organizations. And now I request Professor Venkatesh to take it his use. Hello.
We can hear you.
Professor Venkatesh. Okay, I think he is not able to join or not able to speak, but he sent his.
Mute, actually, is on mute, I think. You need to unmute. Yeah.
Professor Venkatesh.
Yes, he is there.
Hello. Yeah, on behalf of him, I think he sent me a few his views, and on behalf of him, I can put those his views. Can I proceed? Hello.
Yes, sir.
Yeah. What he mentioned, he sent me a few information. In the absence of his presence, I thought I can do it. So what he mentioned was all disinfectants are chemicals and toxic to environment, and soaps or hypochlorite are highly alkaline pH. All viruses, including COVID virus, is sensitive to alkaline pH. Use of alkaline water at pH 8 or above will destroy COVID virus. Simol electrolysis can provide us alkaline water which is environment friendly and destroys virus. So these are the suggestions he has given. What he was mentioning is instead of using so many chemicals to giving it to environment, what he says is alkaline pH water itself can be used wherever it is possible. That is his views.
Very nice. Ramya, can you? So
Yes,
shall
sir.
we now?
Yeah, now we can switch over to question and answers, and all panel discussions are completed.
I think we are losing Dr. Rao.
Yeah.
Yeah, he's back. Can you take over, Dr. Rao?
Yes, there is a question from Anup Sharma. In India, we have seen that people are getting recovered from COVID-19. Can you please explain how it is possible? This I can, any one of you can give your answer. Hello?
Dr. Arun Kumar, maybe?
Yes.
So the question is why the people are getting recovered in India? Is that the question?
The question is, people are getting recovered from COVID-19. Can you please explain how they are able to recover? What all the means?
Maybe the question is that in India, the recovery is probably better.
Yes.
It's probably related to the immunity, etc. Can you please comment on?
So actually, in the very many cases in India, because we are in the very beginning of the pandemic, most of those cases are young people, and they are asymptomatic. So as a natural course of our immune response, the virus will get cleared. So mostly by around 2 weeks, 90% of the people will get cleared of the virus. So this is what we have seen in all parts of the other parts of the world also. But you might think that a lot of people are dying in US, etc. But that is only very sick cases are getting admitted in US. Whereas in India, every positive case, irrespective of their clinical severity, is getting admitted because to contain the disease. So that is why we may feel that more percentage of the people are getting recovered. For example, if you look at Kerala, I think 90% of the people have already recovered. They have only 25 out of 500 people are there in the hospital. Remaining people are all recovered. So most of these recoveries are spontaneous based on our immune response, may not be based on any specific treatment, because we don't have any specific treatment.
Yeah, thank you. Thank you for your answer. Now there is a question from Deepanjan Shankar from University of Manchester.
Can we get Deepanjan from Manchester online?
Deepanjan, okay, now. Is it?
Meanwhile, we can take another question.
Yeah, sure.
There is a question from Subramanian Chandramouli from IIT Bombay. Is it possible to reuse PPE used in hospitals through IV sanitization? So the question was, is it possible to reuse PPEs? Majun, what is your view? Dr. Majumdar?
Well, if it is, as I mentioned during my speech, that it depends on where the PPE has been applied. For example, if it is a household or a person who is not in that high-risk arena, the face masks, for example, they can be cleaned and reused. It can be made, it can be disinfected and reused, and that is why cloth masks are also being encouraged, because otherwise the load on disposal would be still higher. But yes, for the health workers and those who are in contact with the actual coronavirus patients, especially in the ICUs for long hours, for them, I think it could be very risky. So they need to be destroyed. And in the biomedical waste management rules also, there are mentions. And the CPCB, the Central Pollution Control Board, has also come out with recommendations on 18th of April as to how they should be disposed of, and that would be according to the different categories of biomedical waste. So most of them would either go for incineration. Possibly in high-risk areas, they should be incinerated.
Let me comment on something here. There are some interesting questions. I will probably mention that question and then ask people to respond to it. But just after that, Nandakumar, if you can get Dipanjan online from UK.
Dipanjan is online. He can talk.
Yeah, okay. And then after that, Sitaram online from Japan. Okay. But before that, let me ask this question. That is that there was this comment by Dr. Arun Kumar that droplets or micro droplets or aerosols, they are not transmitting. But then Jayanta Haldar mentioned that these droplets or micro droplets, aerosols are also a potential agents for transfer of the virus. Seemingly a conflict and some disagreement for the information of general public.
So actually there is no, it's not a conflict. It's not a conflict, sir. So what I mentioned was that the main driver of the the pandemic is the droplet mode. Aerosol, it can transmit in very closed space, as well as when the patients are put on intubation, when the tube is introduced, or when a process like a bronchoscopy or some procedure is done. So only in those time aerosol plays a role, but in the general public or in the community, aerosol is not the main driver of the pandemic. Because if it was aerosol, that type of transmission was a major, you would have seen a very different epidemiological picture. The current epidemiological picture and all the household studies have really showed that it is droplet is the main driver, then the fomites, aerosols in certain very specified locations, like a very closed room, or when you do a procedure which generates aerosols. So then there is. So that is what I meant.
So currently there is no high risk from aerosols.
In the community transmission or in the daily life transmission, aerosol is not playing a major role.
Can we get Dipanjan online?
Hi, hello.
Dipanjan, you can speak.
Yeah, so my question is to Professor Haldar. He mentioned we have, he has in his lab has developed some coatings which may be the way forward in the case of this new normal situation, and that's very interesting.
So what is the question?
We lost the connection.
Actually, his question was how long the virus can be disinfected in these disinfection materials. That was his question.
Yes, yeah.
It is not clear to me. Could you please repeat it?
Can you hear me now?
Yes, we can.
Yes. Hello.
Yes, so my question to you is that those are very interesting materials that we can coat on the surfaces which can disinfect the virus which may be deposited on the surfaces, but it is an interesting challenge to how fast can these surfaces disinfect the virus, how fast can they work for 100% or near 100% disinfection.
Yes. With respect to the COVID, we have not done yet. As I said during my talk, that we are on the way getting the result. So I cannot say respect to COVID, but I can say the data that we have respect to influenza virus, another respiratory causing virus, which is like envelope, which is also envelope virus like COVID, and also RNA virus. And we could see that within even 30 minutes, it can completely kill. And even 10,000 particle can be even killed completely. So therefore, we believe that this similar way it will be able to kill the COVID, but we need to just wait and see what happened with respect to COVID testing. But we have, as I said, that this is only up to 30 minutes we have tested in one particular time frame. But I believe that even lower time frame it will be able to kill it. So, but we need to do that one, and we are trying to do that experiment and try to see how fast it can kill the virus. Yep.
Thank you.
There are a few other questions. One question is from Dr. Nilima Alam from DST Delhi, asking what are the new opportunities in this sector, especially addressed to Santhya Srivastava, the context of disinfection, in the context of new industry setting up on water management, etc. Santhya, your response?
Yes. So the opportunities, of course, is to look into the viruses in the environmental system, especially the wastewater system. And because we are not monitoring our wastewater system for presence of pathogens. We have some data with respect to what is happening in the European and the US. Now we need to evaluate our wastewater system for occurrence of these viruses, find out certain ways which are simpler to evaluate. Like it's very difficult to work with viruses, we know that. So can we look at some indicator viruses or indicator phages to evaluate them? But it is very important for us to understand our environment and actually base our science or our research to understand so that there is, again, as I keep saying, COVID is one pandemic right now, but we have so many other enteric viruses that are there in the environment. And then how do we control them? How do we prevent them to go to the drinking water system? Or how do we evaluate them even in the drinking water system? So we need to have methodologies which are sustainable to be applicable. And
how do we translate them to industry, Dr. Santhya?
Sorry?
How do we translate them to industry? Question was also related to startups. How do we start some new activity in that?
I don't know. I can't answer this question actually, especially with respect to wastewater.
Management, of course, water management systems. New business opportunities should be arising, and where do you see them coming up? Maybe we can answer this offline. And for want of time, let us, TNVV, what do you think? Should we take one more question?
One more question, actually, very important question I could see.
Yeah, many recurring questions are there.
It is from Vineet Mishra. What would be the best way to disinfect fruits and vegetables? This is actually every day we use, so maybe.
Yeah, that is also repeated a lot.
Yeah, very good. Dr. Arun Kumar, you may have some comments on this.
Fruits and vegetables, we basically cannot use any disinfectant. So you wash with water and then cook it, because don't use uncooked raw vegetables or material. So wash nicely with water and then cook it. So everything will be destroyed.
Oh, okay.
So with regard to the question, there's one more related question is, how do the viruses survive in water, especially when their entry points through gray and black water? We just discussed that possible transmission. So how do we avoid that, or what is their lifetime in water?
So I think there is need more studies on that, because most of the results what we know is by PCR. It just detects the nucleic acid. So that doesn't mean that the virus is infectious or virus is culturable. So okay. I don't think we have enough data on that to make a comment.
Okay.
In that related question, Dr. Arun Kumar, is that should we go and investigate the wastewater? Can this tell us something more about more about this problem?
Yeah, yes, because I think Netherlands already started doing something on that line, because a lot of COVID virus is being excreted in the fecal matter, because virus multiplies in the gastrointestinal tract also, and the virus is excreted. So ultimately this will come up in the sewage. So maybe like in polio, if you do the sewage testing, proper sampling, we must be able to get an idea that which community the virus transmission is happening, because majority of our COVID is asymptomatic, because from a community, we can make out only when there is symptomatic people are coming to the hospital, or all the current cases are basically, it is contact tracing, contact of a already known case. So in the longer term, to map the areas where transmission is possible, this may be a good marker from a community standpoint, like which areas, if you properly do the sampling and properly processed using a standard SOP, it may give an idea that which area is infected.
Thank you. I think we should move on to Sitaram and Sripati, I suppose.
Yes, Professor. Yes.
Sitaram is already there on the panel. You could.
Yeah. Very good evening to all of you, and congratulations to the organizers, particularly Professor Pradeep and Nandakumar, and all the panelists. As it is very late, I'm talking from Tokyo. It's going to be almost 11 p.m. So let me make only 3 important points. The first point is that the messages that we have shared here has echoed the starting point that Pradeep made, which is what is very important, that science is an opportunity for science, for young people to look at new ways of solving problems. But that also brings us, I've spent many years, like Secretary Iyer, working in the water and sanitation sector. India is now having the vision, as the Prime Minister has said many times, to become a big economy with a $5 trillion economy. That is still doable, notwithstanding this pandemic. For that, water and sanitation play an important role. So we should look at not just solutions where we are coping with the problem, but we are actually solving the problem, and take this pandemic as an opportunity to innovate and to change things for the better and make them even more resilient, as was echoed by other panelists, that this is not the only pandemic. We will have many such occasions that we will have to face. So this is a historic opportunity for us. And this is not just only ambition, this is a fact, because many developed countries like Japan 50 years ago had these similar kind of problems. They had diarrhea and other diseases, and they overcome that by solving some of their problems by investing in water and sanitation. So I feel that although we have had about 600 plus participants, there are maybe another 600,000 people who need to know this. So it's important that let's compile this information and widely share these facts and motivate young people to work together. Together we can solve these problems. Thank you for allowing me to share my views.
Very nice. I think Sripati raised a hand, isn't it?
Yeah, Professor, the discussions have been pointing towards one big, action point that we are requiring at this point of time. Is this the sewage water or the discharge wastewater? What happens to it? What have we done to it? What we are going to do about that? That is becoming a huge initiative that needs to be taken up immediately. And there are several people who are during this course of the discussion for past 1.5 hours to come and present. And the next session would be on detergents for disinfection. I am putting some thoughts together and putting some people in the panel for the next week on 14th May. And I see an opportunity here in the 4th meeting also, in terms of the opportunity that the COVID-19 has presented to us, wherein the sewage treatment itself is a huge exercise to be performed, wherein we have several people operating already in this country who can contribute and take a big leap forward. So this is my humble submission. We will request all people who have started working on it and who have been working already in the space, like Ashok Natarajan, he has shared some thoughts on Dr. Arun Kumar also mentioned that this has been done in Netherlands, and he has Ashok Natarajan has said that it has been done in Penang in Malaysia also, in terms of water balance and all that. So this becomes a huge topic for us to as an opportunity to take forward and get the best.
As we are speaking, this is happening very much in Arizona, and I'm personally aware of several activities.
So I complete my point. Thank you.
Thank you, Mr. Sripati. And moving on, we have arrived at the conclusion of the session, I would like to thank all the participants, speakers, panels, and the organizing team. When ICCW was initiated, it was started with solutions to address the water problem. Now we are at a new juncture where the water challenges are existing, but along with that, we have to face the pandemic. So with this in mind, multiple questions were raised, and that has led us to these series of seminars where the first theme was on disinfection, which we had today. The next week, we have detergents for disinfection. I request one and all to join on May 14th, same time. And we have seen a lot of young participants from various universities and colleges across the world. So I'm sure it's a huge benefit to all of us. Thank you. Thank you, all of you.
Thank you.
We could still hold on, 445 people at the very last session. It is fantastic. Lots of people have joined. Hats off to them, and they are the winners of this particular thing. We have not been in a position to handle or take
all the questions.
Please do bear with us it was largely because want of time. We don't want to hold you from your dinner. Good night.
Good night.